Hi, I'm Dr. Danielle Hicks, and this is the treatment group video for factitious disorder imposed on self. And my client is David Curtis, and he's 32 years old. We had two differential diagnoses, malingering and factitious disorder imposed on self. However, we ruled out malingering because it did not meet criteria B. There's two primary diagnostic features for factitious disorder imposed on self, and they are intentional faking of physical or psychological symptoms, and the other one is deception used even though there is no external reward, such as financial gain or avoidance of negative consequences for actions. Now on to David's story. He is a 32-year-old unemployed musician who was presented at the ER of a local hospital claiming to have taken an overdose of aspirin. He stated he ingested a bottle of 60 aspirins and then got into his car and drove into the ER. Once he was there, his stomach was immediately pumped. Once he was no longer in medical danger, he was asked why he had taken an overdose, to which he replied that he'd been depressed lately and thought he didn't want to live anymore, but as soon as he took the pills, he changed his mind. He did not appear to be depressed, and he never sought treatment for depression prior. He proceeded to tell one fantastic story after the next about his personal history, such as he claimed that his father was a world-famous cardiologist who worked on the first heart transplant team. This fact was then deemed to be false. When confronted with evidence that challenged these falsehoods, he continued to insist that they were true. David was admitted to the psychiatric ward with a provisional diagnosis of delusional disorder. However, once admitted, his delusions seemed to stop. His conversations with the medical staff and fellow patients were rational and clearly grounded in reality. His mood and demeanor were of a happy and content man. He freely socialized with the other patients on the ward and quickly became one of favorites among the medical staff and fellow patients. He was able to borrow a guitar and sing songs, entertaining anyone who would listen, and twice a day he would put on a show, after which he would receive praise and accolades. David appeared to be thriving in the psychiatric ward. Due to his lack of symptoms, it was determined that David should be discharged. When he was informed of his impending discharge, he expressed intense dissatisfaction with this decision and began claiming that he was hearing voices telling him to harm himself. He also claimed to be feeling depression, despite his obvious happiness about being an inpatient. It was determined that an additional assessment interview was needed before making the final decision of his discharge. During this interview, he shared a complicated family history involving instability and chaos. His parents divorced when he was 1 year old, and he was shuttled back and forth between them. Both of them had a series of unsuccessful marriage, a total of 8 between them, which resulted in David never feeling safe and secure. They were so focused on their individual love lives that David became a second priority. He then described several years of depression, and it was only when he discovered music that he was able to pull himself out of his chronic depressed state. He made the decision at the age of 18 to make music his career, but chose not to be formally educated. Instead, he sought employment at bars and clubs with only marginal success. He began to slip back into a low-grade depression and discovered that crystal meth could counter these feelings. In order to sustain his meth use, as well as pay his rent and other expenses, he chose to sell crystal meth and stop playing music altogether. At the age of 30, he was caught and arrested for drug distribution, and he had two options: rehab or jail time. And he decided to go to a rehab unit, in which his therapist encouraged him to take up his music again, as he believed it would be very therapeutic. He began to write music and playing his guitar and stated that he felt that he had rediscovered himself. He then started to put on nightly shows at the rehab to rousing applause and praise. He explains that this time in rehab was the happiest time in his life, and he was getting the focused attention that he lacked throughout his childhood, and the praise for his musical talents that he had always craved. David then admits that this is not his first admission to a psychiatric ward since leaving rehab 2 years ago. This is actually his third admission to a psych ward since his discharge from rehab, and he indicated that each admission was at different hospitals in different counties. Each time he would fake suicide, which he knew would guarantee his admission. He would then pretend to be delusional. His first admission was for 3 weeks, and his second lasted a month and a half. This is the first time that David was caught faking his symptoms, and when asked why he did this, he stated, "I miss being in rehab and playing my music so much that I wanted to return to that protective and attentive environment where my music was appreciated." And that is David's story. So the multi-axial diagnosis. On axis 1, we have factitious disorder imposed on self. On axis 2, we have none. On axis 3, we have recent manipulative suicide attempt. On axis 4, we have history of instability and unemployed. And we gave him a GAF of 72. And we have 3 theoretical perspectives. And the first one is behavioral perspective. This client's symptoms may be due to a faulty learning experience. When the client received praise and accolades for his music when he was an inpatient during rehab, he was positively reinforced and therefore operant conditioned. This led to his desire to recreate this situation so that he could get his nurturing needs met. He then faked his psychological symptoms so that he would be admitted into the hospital and once there put on his shows, thereby receiving the praise and accolades that he craved. The second perspective is cognitive perspective. This client's symptoms may be the result of an irrational belief. He believes that faking a psychological disorder for the purposes of being admitted to the hospital is a viable way of getting his needs met. His faking psychosis enabled him to be admitted, and once admitted, he would put on his shows and get the praise and attention that he craved. Finally, the last perspective is family perspective. The client comes from a family of dysfunction. His parents divorced and became so preoccupied with their dating and social lives that David's need for love and attention were neglected. They created a lack of structure, which in turn created a tremendous need in David that led to his choice to get these needs met by faking a psychological disorder. And that's the treatment group video for factitious disorder imposed on self.